Please switch on the microphone. We have reached the appointed hour to start. Let's start our meeting now. I'm standing in for the chairman, and this meeting is about the policy address briefing. Please invite the secretary to join us. Before we proceed to that item, we need to handle something else. The Bureau would like us to take up 3 items for the meeting on the 19th of November. First, preparation for the winter seasonal flu peak period. Second, development of the Hong Kong Children's Hospital. And also the third one, the review of the main tested assistance items under the Samaritan Fund and the CCF. Well, members have expressed some concerns already. Then the chairman and I would take your suggestions on board. All right, so hands up for the policy address briefing if you have questions to raise. So I ask the secretary to start the briefing now before I invite members to raise questions. Well, actually, in the policy address delivered by the CE, she set out the policy agenda in respect of healthcare and health services. And there are 6 major policy areas for which we would devote ourselves on, and also we'll invest resources on. First, promotion of primary healthcare services. Second, prevention of diseases. So we would stress the importance of primary healthcare and self-care, and we'll promote primary healthcare services in the community to enhance the general health conditions in the community, and we would also try to relieve the pressure on the public healthcare system by focusing on areas other than medical treatment. For the development of Chinese medicine, we are going to invite tenders. We hope that the Chinese medicine hospital will be commissioned in the 3rd quarter of 2019, and we're also going to set up the medical community health centers in the Kwun Tong and the Kwai Ching, which will be a pilot cover under a pilot scheme, and we would like to extend it to other districts in due course. First, we are going to introduce measures to control the non-communicable diseases. We have published the document entitled Towards 2025, Strategy and Action Plan to Prevent and Control Non-Communicable Diseases in Hong Kong. We will try to promote a healthy diet and physical activities and reduce alcohol, tobacco-related harms. And also cancer is an important area under the healthcare system. And the Cancer Coordinating Committee, chaired by me, is drawing reference from the WHO recommendations and international practices with a view to mapping up in 2019 strategy related to cancer prevention and services for the period between 20 and 2025. And for cervical cancer vaccination scheme, we are going to provide this free of charge to schoolgirls of particular age groups in P5 and P6 starting from the 2019-20 school year as a public health strategy for the prevention of cervical cancer. As for breast cancer, we are commissioning a study to be carried out by the Hong Kong University, which will be completed in the latter half of 2019. Which would identify risk factors associated with breast cancer. We'll then consider the adoption of different screening services for women. And also we have accepted the suggestion from the Steering Committee on Genomic Medicine to carry out a large-scale genome sequencing project in Hong Kong to enhance the clinical application of genomic medicine and also innovation in scientific research on genomic medicine in Hong Kong. We are going to cover 20,000 genomes in the sequencing project, and we are going to set up an expert group to oversee the process. On the question of e-cigarette, we are going to prohibit the import, manufacturing, sale, distribution, and promotion of electronic cigarette and other new tobacco products. We have adopted different measures on the control of smoking. At present, the smoking rate is standing at 10%. We have plans to further reduce the smoking preference drastically to 7.8% by 2025. And this target is also part of the targets under the prevention and control of non-communicable diseases and the towards 2025 strategy plan. With the promotion of new tobacco products, they are often packaged as less harmful substitute, and they have a promotional tactics targeting youngsters and non-smokers, so that they will be drawn to smoking or drawn to the consumption of conventional cigarette eventually. The fact is, all these new smoking products are harmful to health, and there's no evidence to show that these products can help quit smoking. And the public may underestimate the harmful effect, and they may then endorse the smoking image. Again, having taken into account the views expressed by the medical profession, education sector, parents, and members of the public who have told us that they are concerned about the adoption of regulatory approach for the issue. They are worried that the sale of e-cigarettes and other new smoking products with restrictions in the market will not be adequate to protect public health and bring about negative impact on children and adolescents in particular. After weighing the pros and cons of the regulatory approach as opposed to a full ban, we have decided that to protect public health, we would ban the import and etc. of the e-cigarettes and other new smoking products. This is because we have to take a precautionary approach in respect of such new products. Therefore, the government will submit legislative amendments in this legislative session to ban the import, manufacture, sale, distribution, and advertisement of e-cigarettes and other new smoking products. On seasonal influenza vaccination, we would like to enhance the uptake rate of vaccination. The Department of Health would roll out free outreach seasonal influenza vaccination services for primary students at school in the coming school year. And we also increase the subsidy per dose for private doctors enrolled under the enhanced vaccination subsidy scheme for schools outreach vaccination services. Primary schools not participating in the pilot program will be given a list of doctors that have participated in the VSS scheme, and we are going to cover 230 primary schools, and the VSS will also be expanded to cover people aged between 50 and 64 with an additional 1.8 million beneficiaries. When we have a continuing program to promote mental health services, we hope that the first phase of the new initiative will commence in the first half of 2019. This is to enhance public understanding of mental health, thereby reducing discrimination and stigmatizations, so that we can build a mental health friendly society in the long run. Also, on the advice of the Advisory Committee on Mental Health, we'll commission universities to conduct territory-wide mental health preference surveys covering children, adolescents, and elderly in Hong Kong, to gather information on the mental health status of the Hong Kong population for better planning and delivery services. The third area that I want to highlight is the development of Chinese medicine. In the past year, we have set up a dedicated unit to promote Chinese medicine, i.e. the Chinese Medicine Unit and the Chinese Medicine Hospital Project Office have been set up to plan for the and promote the development of Chinese medicine, and also spearhead the development of the first Chinese medicine hospital. To acknowledge the long history and popular use of Chinese medicine in Hong Kong, the government will incorporate Chinese medicine into the healthcare system in Hong Kong and implement a development framework to provide subsidized and services as follows. There will be a combination of in and out patient services offered by the future Chinese medicine hospital. There will be about 400 beds. We're going to select suitable NGO to run the CM hospital, which will be completed by the end of this year. Secondly, we are going to introduce 18 Chinese medicine centers for training and research at district level with outpatient services. And we've also to provide subsidized service network serving 600,000 patients, and the fees will be set at reduced to 120 per visit. We also provide funding to improve the coverage of the integrated Western medicine system. As the first step, the additional daily fee for integrated Chinese Western medicine services will be reduced from $200 to $120 per day, and we set up a dedicated Chinese medicine development fund to take forward measures for the development of Chinese medicine. And the fund will be up and running in the first half of next year. And lastly, we would like to strengthen existing healthcare services in 4 fields. First, drug subsidies. This is to reduce the financial burden on patients. The HA has commissioned a consultancy study to comprehensively review the existing means test of the Samaritan Fund and the Community Care Fund medical assistance programs. The review will look at the relevant mechanism at present. It's a near completion. Based on some preliminary findings, we suggest modifying the calculation method of the annual disposable financial resources of patient by lowering the contribution of assets that has to be calculated, so as to lower the out-of-pocket spending of patients and to avoid financial hardship. And we also look into the definition of household adopted for the financial assessment, so that we may relieve the patient family's financial burden. Next, support for uncommon diseases. The HA has, together with the relevant pharmaceutical companies, introduced a new program to provide drugs for those with spinal muscular atrophy. And the coverage of the CCF ultra-expensive drugs program has also been expanded to provide patients with subsidy for specific drug treatment according to their needs.
The Poverty Commission in June approved in its meeting that the drug for spinal muscular atrophy will be covered by the ultra-expensive program. And to provide more timely support to needy patients, HA has increased the frequency of prioritization exercise, including self-financed drugs in the Samaritan Fund and the CCF Medical Assistance Program. So starting from 2018, the HA has increase the frequency from once to 12 to twice a year, so as to shorten the lead time for introducing suitable new drugs to the safety net. The third is the handling of abortuses. We fully understand the feelings of parents of fetuses. They might have encountered difficulties leading to anxiety and worries. So the FEHD and the HA have introduced a number of administrative measures to facilitate the handling of abortuses. The government is studying how to deal with this in a holistic manner, including the provision of facilities. The fifth, end-of-life care, to allow terminally ill patients more options of their own treatment and care arrangements. In 2019, we will consult the public on arrangements of advanced directives and the relevant end-of-life care. The fifth area is to ensure that our healthcare system can develop in a sustainable manner that would cover both the hardware and aspect. And the first is the second 10-year hospital development plan. In the budget, 2018-19, $300 billion have been reserved for this second 10-year plan. And we've also invited the Hospital Authority to carry out the first 10-year plan as well as plan for the second 10-year plan, covering 19 projects. And once the second 10-year development program is completed, we will have another 9,000 additional beds and would be more or less able to meet our projected service demand up to 2030. We also want to ensure that patients can enjoy healthcare services in a comfortable manner. So the Department of Health will gradually refurbish its outpatient clinics, and it has identified some clinics for in a pilot scheme. Training of our healthcare personnel is important because our manpower is tight, and therefore we need to increase the number of training places. In 2019-20 to 2020-21, the UGC will increase over 150 subsidized first-degree program places, and that will cover nurses and doctors and PTs and OTs. So there will be 1,930 more places. And to increase the training capacity of healthcare personnel, we have increased $20 billion for enhanced CU, HK, Hong Kong U, and Poly U, their training facilities. We'll carry them out in the short, medium, and long term, and then we will submit applications to the council so that the three universities can expand their training capacity in a timely manner. And the Prince Philip Dental Hospital is the only dental teaching hospital in Hong Kong. It was built more than 3 decades ago, and some of the facilities are rather dilapidated, so we will renovate the hospital very shortly. In the long term, we hope to identify a new site for its reprovisioning. As regards the voluntary health insurance scheme, we will fully implement and promote the VHIS will provide tax deduction to encourage the public to purchase certified plans so that they may choose to use private healthcare facilities when needed, so that in the long term we can alleviate the pressure on public healthcare system. Now, regulation of public health. First, we have to set up a full-fledged office for regulation of private healthcare facilities. In the private healthcare facilities bill, well, in fact, the examination of the bill was completed in the largest legislative session, and upon passage of the bill, the Department of Health will set up an office for regulation of private healthcare facilities to undertake the relevant statutory enforcement work to ensure patient safety and protect consumer rights. Regulation of medical devices. We plan to legislate to regulate medical devices. For pre-market control and post-market control, we intend to submit a bill to the Council for better protection of public health. Third, regulation of advanced therapy products. ATP is one of the fastest moving areas in the medical field at present. In view of its special and complicated nature, we will introduce legislation to regulate ATPs to safeguard public health. And we will have a clear regulatory framework to facilitate the development of innovative medical products. Lastly, regulation of healthcare professions. We are following up on the report of the Strategic Review on Healthcare Manpower Planning and Professional Development, which was published in 2017. We've invited the regulatory bodies to submit proposals to the government on regulation and development of healthcare professions, including how to take forward mandatory continuing professional education and development, review of the dentist's registration ordinance, implementation of a voluntary registration system for the development of nursing specialties to pave the way for setting up a relevant statutory registration system, and review of the regulation and development of allied health professions. The Bureau will proactively implement the various measures and policies I just outlined, and we are all ears to members on our views to these policies and measures. Thank you, Professor Chen, for your very detailed presentation. Mr. Goka, Silvajan, Tony C., Yu Siwing, Fernando Zhang, Elizabeth Quat will ask questions, 5 minutes each. Dr. K.K. Kwok. Thank you, Chairman. I have to praise the administration for banning e-cigarettes. They have saved our younger generation. But when it comes to healthcare services, I'm afraid there is nothing new in the policy address. Patients are waiting longer and longer for treatments. The secretary said that the second hospital development program will end in 2023. Let me tell you the situation in hospital authority. On average, the bed occupancy rate is 140%, non-peak period 106%. So they have to wait until 2036. So you're telling Kaifongs of Yunnan to wait for another 18 years, and they may be luckier. Compared with Lantau tomorrow, this is so different. The Lantau development tomorrow is planned to stretch beyond 2046. For public healthcare patients, they will only be taken care of when the government has extra money. And as for the patient strategy, we have many people waiting for receiving target therapy and expensive drugs. And of course, you have planned to help spinal muscular atrophy. This is a good thing. But apart from SMA patients, we have tens of thousands of patients with other diseases. And for mental patients, young mental patients in particular, you have appointed Mr. Wang Yanlong to be the chairman of the committee to review services for mental patients. Now, you're going to start a survey in 2019 for completion in 2022. Many children have to wait for 2 to 3 years because they can receive their first treatment in mental care. And they may have to wait for another 3 years and then 4 years before they can receive appropriate treatment. So there is nothing new. We're spending 2.7% of our GDP on healthcare, 0.25% in psychiatric care. So, Professor Chen, we ask the administration not to squander money on the Lantau Tomorrow vision. Rather, more money should be invested in healthcare so that we can do better than 2.7% of our GDP, and let's make it up to 3%. And for resources for psychiatric services, increase it to 0.5%. Because even if you have you want to increase manpower, you don't have enough money. And then for mental for patients waiting for child psychiatric services, they have to wait for 4 years. Can you do something about it? And for vaccination, this is a minor issue. You are going to cover those who are in their P5 and P6. Now, will you provide retrospective services for for girls who are no longer in their P5 and P6, because when they enter into adolescence, they are exposed to more risk, and I think the most risky period is when they are in secondary school or when they have graduated. Thank you for your support for our work on e-cigarettes. We plan to submit a bill to the Council for scrutiny within this legislative session. Regarding the second 10-year hospital development plan, you quoted the example of Tuen Mun. The expansion of Tuen Mun Hospital, including as operating theaters, is underway. We have already secured funding for that. All the projects covered in the first 10-year HDP is progressing. We don't wait until the first 10-year plan is completed before we start the second 10-year plan. Can you please answer directly to the question of the percentage of GDP we spend on healthcare? When it comes to resources spent on healthcare, whether you talk about the $500 billion in the first and second 10-year HDPs, we have been all along increasing resources to healthcare. I will very quickly answer the question on cancer. Now, it's not that we will stand still while we are working on the cancer strategy. For drugs proved to be effective for cancer treatment, they will be gradually incorporated into the normal mechanism. And for psychiatric services, I understand Dr. Kwok's concern, and the hospital authority has been doing a lot to shorten the waiting time. I think the bottleneck is not really money, but manpower constraint. HA has been recruiting more manpower for psychiatric services in particular. And as for cervical cancer vaccination, the pilot scheme we are doing is a project under the Poverty Commission. It will last 3 years. We will let the program run its course, and a new program will start in 2019-20. The Department of Health will start to help P5 schoolgirls to get vaccinated. Mr. Shugajan, I've got 2 questions. In point 1 of your speaking note, primary health care, on the 26th of September in the tendering forum for the DHC, it said that you have chosen 51 Kwai Chang Road, 36th floor for the call center. Why have you chosen this site? Because even a search by Google Map will take 9 minutes, and there may be people with disabilities and who are rather aged, and this is not a very conveniently located place. So, given that this is a pilot scheme, why have you chosen such a remote area?
And we know family medicine and family doctors are important. According to the head of the College of Family Medicine, Dr. Chen Ming-wai, only 32 medical graduates are training to become fellows of family medicine. He said at least we would need 100. I know you have a plan to provide 60. So why are you providing 60? And not 100, and also the 60 doctors are not just for family medicine. And also on the part of regulation of healthcare professions. And you also mentioned that we'll review the regulation of development of allied health professions. And in paragraph 202 of the policy address, it said that the government will also complete and evaluate the pilot accredited register scheme for healthcare professions and study how to formulate a statutory registration regime for related accredited professions. We haven't even resolved the problem with clinical psychologists, and also the voluntary scheme has yet to be completed, and now you want to go for a statutory one. I've received a letter from an organization representing clinical psychologists, and they mentioned the difficulty to arrange a meeting with you. We would like to express our views through a meeting to the Food and Health Bureau, but they have not responded to us positively. And now you are talking about a statutory registration system instead of a voluntary one, and yet you haven't been able to meet them. Well, I'm all in favor of implementing the voluntary pilot scheme. And then we can move on after that. On the site selection for the community health centers, we have done this through consultation. There's a working group responsible for for the setting up of Ching community health centers. There were 5 candidates, and we ended up choosing this one because it's a central location. It has a direct connection with the MTR station and is accessible by bus. So this is what we call a central location. Of course, ideally, there will be other government facilities there, but we need to strike a balance because we want to start the service earlier. So it will be it's also a viable option to lease the premises. As for family doctors, we need to promote primary health care. Therefore, we need to increase the pace with which family medicine is developed. This year, we are going to have 100 additional places for medical doctors and undergraduate programs. And also, some years ago, we also increased the number of places, and these graduates are coming on stream to provide the service we need. And we are going to talk to different professional disciplines on the future direction of development and service delivery. On the question of the pilot scheme, pilot accredited register scheme for healthcare professions. Yes, it is a voluntary scheme, and we are now taking forward the preparation for the relevant statutory registration system. We have commissioned the Chinese university to talk to the stakeholders under the pilot accredited register scheme. I know that they are having meetings, and then we want to achieve the longer term objective of a statutory system. So that won't happen in the near future? No, because as you have said, the pilot project has yet to be completed. Secretary, I remember that in the last session, when you came to talk to us, you said the community health center in Kwaichung is more like an office than a clinic because you are going to set up satellite centers, right? So you do not expect a lot of patients to go to the center like an ordinary clinic. Well, the center is also providing a network-based service. It has a space of 15,000 square feet, so we expect some visitors as well. But it's not a clinic. The doctors and the Chinese medicine practitioners in the district will be linked up in the network, in the system. There will be Tier 2 and Tier 3 prevention services to be provided. Well, the relevant organizations have tried to meet the officials and they have not been able to do so far. Can you tell us why? Well, we have asked the Chinese university to do this for us. We would try to understand what has happened. Mr. Siu Ka-fai, I have a short question. I hope a short answer will be given. On the question of a heat-not-burn cigarette and the e-cigarette, at first the government said they will be regulated. Now you go for a total ban. So you ban the import or the sale of such products. Would the use of these products by the public be against the law? Thank you, Mr. Siu, for your question. On the question of a heat-not-burn cigarette and e-cigarettes, we are now proposing the ban of import, distribute, promotion and sale of such products. As regards whether some other acts are permissible, but we are looking into the legislative provisions right now. Please let us know your views if you have views to offer. So is it against the law? Is it going to be against the law to smoke such e-cigarette products? If you're not smoking in a no smoking area, then it's not against the law at the moment. We'll look into this aspect when we draft the legislation. So after the legislation is enacted, my understanding is that you will not, the sale, etc., is banned, but not the use of the products. I don't know. Maybe we'll leave these questions to the Bills Committee when the bill is up for scrutiny. So I want to just to ascertain whether it's going to be a ban on sale, etc., but not the use. We're going to amend the current legislative framework on smoking. At present, smoking in an area which is not a non-smoking area is allowed.
之外嘅話，其實啲人可唔可以吸食？
So my question is whether after banning the import and sale of such products, it will be lawful for people to use it in Hong Kong. I've spent some minutes on this, but I haven't got an answer. My answer is that we are looking into the details at the moment. So are you going to ban the buying and selling? And you're not going to tell us now whether it will be lawful to use such products? Some people are wondering whether they are going to commit an offense in the future if they continue to do this. Well, in the old Cantonese film, there are people who would never buy cigarettes, but they never quit smoking either. Well, the relevant control framework will be subject to further discussion with different government departments. And this is exactly what we are doing now. Well, the CE said in the policy address that over 20 countries have banned e-cigarette. According to the government, we have Argentina, Panama, Cambodia, Greece, Libya, Mauritius, Nigeria, Nicaragua, and Singapore. Actually, in 83 countries, such products are regulated. We have UK, US, Canada, New Zealand, Italy, Japan, Korea, etc., which are similar to Hong Kong. These countries with which we have a lot of exchanges. So why are we following the example of these little visited countries? Secretary, when we come up with smoking controlled measures, and this is exactly one, we have to look at the new products and also the implications of new products on our smoking controlled system, and how to what extent our control system will be impacted. And of course, the first priority is the health of our people. In the countries that you have mentioned, they have conducted studies that within a short span of time, many young people are attracted to the use of e-cigarettes. So this has caused a grave concern, and therefore we go for a total ban. A few weeks ago, the relevant educational and medical groups are talking about the banning of e-cigarettes. Many of them cannot really tell the difference between heat-not-burn cigarette products and e-cigarettes. Of course, if you allow young children under age 18 to buy such products, of course you are going to attract young users. But what about adults? Why do you want to take away the choice of adults? You've heard the lists of countries. Are we in a close relationship with these countries? Why do we follow them? Follow their practice? Why don't we follow the practice in those countries which are familiar to us? So if the ban would mean that people will be forced to buy in the black market. I know that I have used my 5 minutes, and I know you're tolerant, and you allow me to speak further, but I don't want to hold up other members. Is there going to be a second round? Yes. There's a saying that you can't draw blood out of a stone. And I believe they would be presenting a bill. In due course, there will be a bills committee, and please work harder to see whether you can extract whatever answers that you want on those occasions. I'm not a smoker. I don't use traditional tobacco products or e-cigarettes, but I object to this proposed ban on e-cigarettes and new smoking products or new tobacco products. What are they, according to the government? According to the chairman, the government is not going to give us a satisfactory answer, however hard we ask our questions. I can only say that this is a very rash decision. It hasn't thought through the matter. This is an abrupt about turn. Last year, Secretary, you came saying that these products will be regulated. And now in the policy address, we witness an about turn, and you are going to go for a total ban. What has happened in the decision-making process? What new evidence emerged in the interim so that you want to make a different decision now? Please explain to the public.
I have friends who have switched from conventional cigarettes to heat-not-burn cigarettes. To pass a word to you, he said that he feel that e-cigarettes is less harmful, and the impact on his friends is also lower. And he said that he has no choice now but to return to conventional cigarettes. So it's like you do not ban real guns, but you ban air guns, or in fact not really air guns, but the bullets. Now, if you have that device for heat-not-burn products, now you are going to prohibit the import, manufacturing, sales, distribution, and promotion, but not possession. Theoretically speaking, if I possess the heat-not-burn tobacco products, I have the process and the QoS, well, you are going to totally ban a product which is not as harmful as conventional cigarettes. I would like to know whether the possession of such things is a crime. You cannot answer us today. And is it a crime to distribute or to give one to a friend or to sell it? Now, it goes to show that the government hasn't considered the whole thing thoroughly. The logic is unclear. And now you say that because of the views from the medical and education sectors and also parents, no, this is not fair. In the middle of this year, you said there would be regulation, and as a result, those taking such cigarettes did not come out to oppose fiercely. Now, I think you should conduct a full consultation to allow all stakeholders to express their views. There should be a thorough debate before you come to a conclusion on the new policy. But now you haven't given people who are willing to pay tax for e-cigarettes a time to address the situation or to make known their views. Isn't it unfair? Mr. Chen, you were referring to the sharing of e-cigarettes as well, sharing the same e-cigarette between two persons. Thank you. Whether it should be regulation or prohibition, I think we have to depend on scientific evidence and also circumstances in Hong Kong. What new scientific evidence has emerged in the past couple of months to the extent that from regulation you've turned to prohibition? In the past few months, we have seen different sectors, including those from the medical sector, expressing their views to us. And we have also, there are also local studies, local research to cause us to worry that e-cigarettes and heat-not-burn cigarettes may attract youngsters. In fact, it's not just us. Parents, teachers, and members of the public are also concerned, and there is also a rising trend for the taking up of e-cigarettes. And in other countries, there is evidence to show that within a very short period of time, many youngsters have got problems with smoking e-cigarettes. So for any policy, when we have found evidence or local circumstances, we can adjust the policy, and this is our current approach. My first question has not been answered. My question was what is meant by new tobacco products at this stage that include heat-not-burn cigarettes. I think she has not yet answered your question in relation to the whole rationale behind the new policy. Mr. Poon Siu-ping, thank you. In para 175 of the policy address, the PA they see that health care services are likely to issues of greatest public concern just after housing. And the Secretary explained to us that there will be the second 10-year HDP, and there will be another 150 places for training places of doctors. Now, I am concerned about the allied health sectors as well. and the supporting personnel. I hope you understand that when you have a recruitment, there are a lot of candidates or new recruits, but they tend to leave very soon. The wastage rate is very high. As a result, those serving face a heavy burden. So I think you should address this issue. So for the supporting grades, what can you do to help? Can you conduct the review of their remuneration and conditions of service as soon as possible, so that you can attract relatively young people to join the healthcare sector? And the policy address said that Chinese medicine will be included into our healthcare system. So the Chinese Medicine Hospital is under planning, and for the 18 Chinese Medicine Centers for Training and Research, at a public hearing, there were many CM practitioners who came to tell us that their pay and conditions of service was far from desirable, and therefore they would like to see improvements. I'd like to know whether there is any specific proposals to address the pay and conditions of service of CM practitioners. Thank you. First, on manpower. You mentioned the supporting personnel. We agreed that the supporting grades are very important in hospitals. Their workload is heavy. With the introduction of statutory minimum wage, the wastage rate of these grades is high. So we are trying to see how we can improve their pay and conditions of service, so that the wastage rate will not be so high. The HA is already working on that, so Mr. Poon can rest assured. After the study is completed, we will look at the way forward. May I interrupt? When do you expect the study to be completed? Because the colleagues concerned are very eager to know because the workload is heavy. We understand. We're going to conduct some study very soon. Hopefully, by next year, we can have some conclusions, and we will determine the way forward. As regards the pay of CM practitioners, I think members understand that we're going to incorporate Chinese medicine into our healthcare system. We haven't got a Chinese medicine hospital. We're just planning to build one in the 18 CMCTRs. We have been adjusting the pay of CM practitioners. Of course, CM practitioners may feel that there is room for improvement, and we are studying how their pay can be further enhanced. The Food and Health Bureau has increased resources to CMCTRs a number of times, asking them to increase the pay for CM practitioners. We will keep an eye on that. Dr. Helena Wong. Chairman, I appreciate the government's efforts in promoting primary healthcare services. In paragraph 4 of the paper, we're told that the government will provide substantial services or resources to subsidize the operation of district health centers. And then I came to know that it's just $100 million a year. Isn't it too little? So to support the operation of DHC at Whiting, you are going to support its recurrent expenditure for 1 year. You spend $61.5 billion for HA, and then you have spent a total of $50 billion for two 10-year DHPs. I agree that hospitals are important. You also say that you attach significance to primary healthcare services compared to $61.5 billion for HA and $500 billion for new hospitals. You're going to spend $100 million on DHC only. I now understand why so many people took to the streets to oppose the planned expenditure of $1,000 billion on Lantau tomorrow, and you're also providing more money to district councils. Now we want to improve primary health care so that hospitalization will be reduced, and yet you're only providing $100 million. Are you sincere, or are you kidding? So do you have further questions? Please answer this question first. Of course, we are very sincere. The government is always want to turn over this approach of treatment-based emphasis in treatment. So is $100 million a lot of money? No, allow me some time. $100 million a year is just for one district. Now, for HA and Department of Health, the operating expenses are for all facilities. But this is a new DHC, and we'll talk about the money for one district only. And we have not taken into account the infrastructure yet. And for $200-300 billion for the HA, they are for hardware. And for DHC, this provision hasn't taken into account rent and other things which will be paid by the government. So the question is not about the money, but we're willing to provide the services, and this will be done in a systematic manner. Well, where your money is, where your heart will be. $100 million, I don't see how it can improve primary health of the public. The DP urges you to provide more money on primary health care. I suggest you to set up a $10 billion fund for primary health care. You're going to squander $1,000 billion into the sea. You may as well set up a fund so that everyone in Hong Kong can receive a free medical checkup and an eye test and dental checkup, so the money can be spent on members of the public to ensure health and that they don't need hospitalizations.
I would say that even if you spend $1.8 billion for the 18th district, it wouldn't be sufficient. I'm not asking you to diverting the resources from HA. Mrs. Carrie Lam has said that she won't heckle over resources. Ask her for more resources. Why can't you include cover CM, dental services, conducting blood tests? Well, she's got lots of money. Why don't you ask her to give you more instead of dumping the money into the sea? Well, we are going to have CM services, Chinese medicine services. And we have looked at the data, the big data for the districts. And I think the focus for us now should be chronic diseases. So that's the focus for the time being. Of course, there are other measures to tackle other situations. In the last financial budget, the financial secretary stated that, well, this 100 million budget is our estimate. FS has said that the development of primary health care services in the district will get full financial support. So rest assured that we won't be short of money. But in the last session, you submitted a paper on how these money will be spent on subsidizing different services. Maybe you can bring the same information to the attention of members in the current session. Mr. Yu Si-wing, I have a question about e-secret. According to the policy address, you ban import, sale, distribution, and so on and so forth. So the literal reading of the wording seems to suggest that the use would not be unlawful. There are many tourists coming to Hong Kong. They may bring with them e-cigarettes for their own use. In some countries, such as Thailand, they have strict rules. If they catch you, you will be lashed with a hefty fine of $500,000. So we need to consider how we deal with the importation of e-cigarettes by tourists or by Hong Kong residents for own use. We should introduce a liberal regime so as not to affect our international image. The current wording would introduce a lot of gray area. Maybe we should learn from other countries. Second, about the healthcare voucher scheme. I've heard from some of the elderly citizens that in using the healthcare vouchers, they are misled by the clinics or the optical shop, and then their voucher is spent on products that they may not need. And the loss can be from $1,000 to $3,000. So how can we avoid this? And after they spend the entire value of their voucher, they would not have anything else for healthcare services. Maybe we should come up with something, some measures, like amending the trade description ordinance, so that consumers will not be misled into using their healthcare voucher in unnecessary products. And for the Chinese medicine clinics and hospitals, you are going to reduce the fees. And we know that they are operated by NGOs. How can you help them cut costs? And you want to enhance training and improve the remuneration as package and so on and so forth. All of these cost money. How are you going to help them to do all that? Well, as regards the views expressed by the member on the importation of e-cigarettes by tourists, well, we would look into this in the legislative exercise. We would work with the Customs and Excise Department, and we'll make reference to countries which have already banned e-cigarettes, and we'll find a suitable means to regulate this. As for the healthcare voucher for the elderly, we have received representations and complaints that there are problems when they go to an optometrist, and there are quite a number of complaints of this nature of some malpractices. We have uploaded the data on the range of prices on our website, and we'll also remind the users of the voucher system of the practices that we would like them to follow. We've asked the Chinese universities to conduct an assessment on the elderly healthcare voucher system. And after that is done, we'll take a global view on how we may enhance the system to prevent abuse of the voucher system on the Chinese medicine clinics and the services. As I've said, we are going to increase the subsidy for the outpatient services. We're going to cover 600,000 patients, and some of the self-finance items such as acupuncture and massage, they will be covered by the subsidy now. And we're going to increase the provision of resources to the operator so that they can reduce the fees as well as providing more services. When are you going to do that for the NGOs? Can you tell us the timetable or your plan for the new arrangement? I'll ask my new permanent secretary to say something. We need to ask the HA to talk to the relevant 10 organizations on the new tender system. We believe that the new scope of service can be implemented in a year or so. Dr. Fernando Zhang and a number of members have yet to offer their comments and ask questions. So the first one, Dr. Fernando Zhang. We are in favor of banning e-cigarette and heat-not-burn tobacco products. Earlier, Dr. Kwok-Kake and I sponsor a motion to ban these tobacco products. But the secretary is rather tight-lipped in telling us the details on how the products will be banned. There are differences in opinion, so you should listen to more people on how to ban these products. And if there's something that you need to reconsider or provide more details, please do. And now this time we have heard from the government that there is a cancer strategy. I've never read any official document on cancer strategy. Maybe we can be given more information from the secretary. Many cancer drugs are not covered by the safety net system. They are either not in the drug formulary, or they are self-financed. And there are charitable funds set up by newspapers for the purpose of purchasing cancer drugs for needy patients. So what we are doing is not in commensuration with our status as an international financial hub. So is there going to be a mechanism which would involve the participation of patients? Are you going to shorten the waiting time? According to the HA's website, you have to look at the time taken from diagnosis, confirmation to treatment. For example, colorectal cancer, the waiting time is 2 months. I'm talking about confirmation of the diagnosis, and the time taken from diagnosis, confirmation to treatment or operation. And a long waiting time is not acceptable because the conditions would deteriorate in the waiting period. And also you have commissioned a study. When will the results be published? I know the CE is compassionate about SMA patients, spinal muscular atrophy patients, but it takes more than sympathy on the part of CE to deal with the needs, the drugs needed by the patients suffering from rare diseases. We proposed a scheme which you rejected, and now this year you want to inject another $500 million for the assistance program. And there is already evidence showing that we are much slower in introducing new drugs for these patients than Europe or the UK and the US. And Dr. Charles Cao has recently passed away, and he wanted to enjoy his last days in a comfortable environment in his home. His wish was not granted. So how come we are doing this in such an affluent society? And also I know that for psychiatric services, you haven't been able to do much. I know that my time is running out. Perhaps I'll reserve some questions for the next round. Thank you, Dr. Jiang, on cancer strategy. In the Food and Health Bureau, we have a cancer coordinating committee, which has been around for a long time. The committee is responsible for the surveillance and treatment strategy of cancer, and they have been doing this for some time already. But this time we talk about the formulation of cancer strategy, so that we can look at prevention, care, treatment, and rehabilitation, the whole process in the entire treatment chain, and come up with the right measures. Some have proposed more screening tests be conducted. The Department of Health has got scientific committees to look at different issues. We hope that we can come up with a strategy which provide more insightful views. As for the offering of cancer drugs, the HA has got its own mechanism. They don't have to wait until this cancer strategy is fully formulated. Do we have a document setting out the cancer strategy? Well, we are working on it. There will be a paper, and we will look at strategies adopted by other countries, and also how such strategies can be applied locally. As for the subsidy for drugs, and as I've said, the HA has commissioned a consultancy study. The study is about to be completed, and we have proposed changing the calculation of the assets under the means test.
They would like the resources to be discounted in disposable resources as far as possible, and to lower the part to be paid by patients. And some also asked whether there should be new definition for household. So we have promised to review the definition of household, and we will introduce improvements along this line. What about end-of-life care? Yes, the HA has got end-of-life care strategy. We want to offer more choices for terminally ill patients. As the member said, some would rather like to spend their final days at home, but there must be legislative support first. So for advanced directives, we plan to consult the public in 2019. After that, we will consider whether legislative amendments are needed. Ms. Alice Mack. Thank you, Chairman. First, the call center of Quieting DHC, it is said that it will be commissioned early next year. What about other smaller the satellite centers? Is there any timetable for their commissioning? And as for a review of the effectiveness of healthcare voucher, I hope you can ensure that they will not be abused, and you should also increase the value of vouchers. A couple of days ago, I went to GP clinic, and an elderly man urged me to seek a review of the voucher because the value is really not enough to help our elderly persons. And you know, the general outpatient clinics of the public sector have a very long waiting, have a very long queue, and then support for doctors and nurses, and also the airline staff. We have met with you, the staff associations, and in hospitals we have staff other than patients and doctors, and the other personnel also face very severe manpower shortage. I hope you can review the whole HR arrangement. If you do not improve their pay and conditions, then you can see that the wastage is higher than recruitment. And this is not really giving good services to patients. If you want good services in hospitals, you must ensure that we have a stable supply of staff. And I hope you can show us some progress in this regard. Many colleagues talked about the prohibition of electronic cigarettes. Now, I support the PA's proposal to ban all e-cigarettes and new tobacco products. Some members may disagree, but I think this is an important landmark in discouraging smoking. If there is anything to criticize the government, is last time it was too timid. It only decided to regulate it instead of ban e-cigarettes. Now you have decided to ban them. I hope you understand that for the sake of public health, you can show determination in taking forward this proposal, so that we can have a total ban of e-cigarettes ASAP. Thank you. The call center of the Quieting DHC will be commissioned in the third quarter of next year. And as for the 5 satellite centers, this will be handled by the contractor. We hope that within next year, all 5 satellite centers in sub-districts can be up and running. As for elderly healthcare voucher, as I said, we have commissioned the CUHK to carry out a review, and it will be a comprehensive one. And as for the value, we have increased it from $250 per voucher to $4,000, and we've also lowered the eligibility age to 65 years old, and that is huge financial implications. And as for the wastage of the supporting staff in the DHA, we agree that there is a problem because such staff are very important in wards. So last time we had a meeting with you, and after that, the HA has been working very hard. to consider the wastage rate of such disciplines, and also the impact of brought about by SMW, and HA will see what can be done to lower the wastage rate. HA is conducting a study. Hopefully by next year there can be some proposals from the HA, and I thank Ms. Alice Mack for her support of our prohibition of e-cigarettes and new tobacco products. Dr. Elizabeth Quat. I also support the government's decision to ban e-cigarettes and new tobacco products. I've seen a lot of marketing efforts on the internet targeting our young people. They come in attractive packages and different flavors, and many young people will be tempted to have a go. So I urge the administration to effect a total ban ASAP, and of course you must do the job thoroughly. And we're happy to see that finally in 2019-20 the government is going to provide cervical HPV vaccination to P5, P6 schoolgirls. This is a welcome move. In fact, junior secondary schoolgirls are high-risk groups as well. So, can you give free HPV vaccination to this age bracket first, and then next year you start with P5, P6, so that we can give protection to this group of young girls as soon as possible. And I'm pleased to hear that you may consider adopting a kind of screening for breast cancer. And all along, we want to expedite the introduction of new drugs into Hong Kong. We'd like to see how this is going to be done, and how soon can we have new drugs. We have earmarked money under the Community Care Fund. We hope that the money can be devoted to the treatment of cancer. And as for support for uncommon diseases, we understand that the administration has done a lot to help SMA patients. In fact, there are many different types of uncommon diseases involving a lot of patients. We have succeeded in convincing the government to set up a database for uncommon diseases, so that there can be an early diagnosis and intervention. Thank you. Secretary, thank you, Dr. Quat, for your support for our proposed prohibition of e-cigarettes and new tobacco products. We're going to present a paper to this council as soon as possible to that effect. As for free HPV vaccination, in the school year 2019-20, the Department of Health is going to provide free vaccination to schoolgirls at P5 and P6, and that is the recommendation of the two scientific committees. As for breast cancer, as said in the policy address, we have commissioned the Hong Kong U to conduct a study to identify risk factors. We hope that by the time the study is completed in the latter half of next year, we can then decide on the way forward. As for cancer strategy, our cancer coordinating committee is reviewing HWA's recommendations, international practices, and actual local situations, and we will come up with a document for cancer prevention and care services for the period between 2020 and 2025. We hope that we can will be able to do something for this period, and the strategy can be clearer. As regards uncommon diseases, I think drugs aside, HA has different services for such patients, such as counseling services and also care and services. The HA has a comprehensive idea. And Dr. Kwok asked whether you will cover all junior secondary school girls under the HPV vaccination program. Well, the two scientific committees recommend that we cover P5, P6 schoolgirls. So we will follow their recommendations. For uncommon diseases, as I said, the HA has a comprehensive strategy for care of patients with uncommon diseases, and we are reviewing that. Will the Secretary refer our views on free HPV vaccination to the two scientifics for consideration? Can the Department of Health please elaborate on the recommendations of the scientific committees? Dr. Chen. Dr. Chen, in addition to the recommendations by the scientific committees, the administration has commissioned a study by the School of Medicine of Hong Kong U, and the study concluded that P5, P6 is the most effective age for the vaccination to be given, and the two scientific committees also agree. So as a first step, we would like to start with P5, P6 schoolgirls, because for all vaccination program we have to have a cutoff point. So we will start with P5, P6 age group first, and then later on we'll see whether we're able to expand the scope to other age groups. Mrs. Regina Yip, let me declare interest. I hold stocks shares in the American Tobacco Company. Now, Mr. Shugajan asked what new evidence were there. Well, in fact, the 5 suppliers producing e-cigarettes, they account for 95% of the market share, and they found that the use of e-cigarettes among young people or have come to an epidemic level, and they are very addictive, and these 5 suppliers are required to provide suggestions within a very short period of time to prevent abuse among young people. Otherwise, there will be a total ban, and I assume that the government is aware of the latest development in the medical sector as well.
We should, of course, look at the latest evidence from the medical sector. Let me now talk about uncommon diseases. The CE has in recent months talked about how we may further help these patients. But what is the definition? I've asked doctors of HA this question. The CE has mentioned SMA and the expensive drug that we need to use. What about other diseases? How many patients are we going to help? How much money will be spent? Where can we get the resources, and on what basis would the resources be allocated? And there are other cancer patients, terminally ill, patients who need expensive drugs. So what factors would the government consider in extending help? Of course, we want to be nice to everyone, but what are the criteria? I'll ask the HA to talk about the drug policy of their hospitals, because apart from patients suffering from uncommon diseases, there are other patients who need drugs of different kinds. And we have now set our sight on expensive drugs needed by uncommon diseases, but actually there are also inexpensive drugs, and there are also medicines for common diseases which are expensive. So I ask the HA to tell us more about the factors that they would consider in prescribing drugs. The Secretary is right. A disease is a disease, whether it's common or not. The question is whether we are in a capacity to diagnose new diseases, and also we have to decide whether we need to use new medicines. Sometimes new medicines are expensive. We need a mechanism to decide whether to use the new medicines. In the future, with the advent of new therapies, we may need to spend lots of money on common diseases such as immunological treatment. So the question is, are we able to diagnose new diseases? Are we going to come up with new treatment? And whether we have a mechanism to deal with cases when expensive medicines are needed. It's not appropriate to draw a line between common vis-a-vis uncommon diseases, because it's not easy to come up with a clear-cut definition. And even if we manage to do this, it may not be very fair to other patients. We're talking about expensive drugs for either common or uncommon diseases. How do you decide whether certain expensive drugs should be prescribed? We'll look at the efficacy of the medicine concerned, and also we compare the efficacy of existing drugs and new drugs. That's the cost benefit analysis. And our experts will look at what other countries are doing and the use of new drugs, and then we look at the costs. And then the next question is whether we are going to provide this more subsidy. And this is a separate decision to make, apart from the decision to offer treatment. It seems that apart from breaking up the portfolio of the Transport and Housing Bureau, maybe we should also do the same for the Food and Health Bureau. In the briefing, the Secretary has touched on a large number of issues, but it seems that our attention is focused on certain limited issues, such as e-cigarettes.
譬如話啲預防性質嘅，即係我成日都相信嗰個即係80-20嘅道理 80-20。
Well, we have to be mindful of the 80-20 principle. I believe e-cigarette will certainly remain in the last 20% of our areas of attention. I hope the Kwai Chung community health center will be set up soon. I know there will be another one in Kwun Tong. We'd like to see the important or measures which can bring about significant changes and improvements can be implemented first. I have to declare my interest as a non-smoker, and I don't represent these the tobacco industry. I think that our freedoms are being curtailed. I believe in in free choice. I believe in free choice, and also the rationality of competitive merits. I know many people support the proposed ban, including legislators, but please do not ignore the needs of a small number of smokers who may need to use e-cigarettes for mitigation of harm. And there are issues which are more harmful, harmful substances such as sugar and salt that we need to look into. Recently in the US, they are talking about reducing dietary intake or fasting, because a lot of benefits can be achieved through reducing the insulin level, for example. I know it's difficult to change behavior or customs and habits. If you advise people to have light food or eat less, it's not easy to achieve actual changes in behavior. But if we are successful in this regard, we can reduce healthcare bills quite significantly. So these are more important areas. I'm also concerned about psychiatric health. For those members who work in the district, our ward officers would certainly receive requests for assistance, or some are harassed by the mentally ill person. So perhaps we need to do more in helping these patients. And also for end-of-life patient care, I know the consultation will start soon, but this is not a complicated measure. We need to move ahead. For example, to make it possible to arrange for advance directives, and we need to make it possible for people to pass away with dignity. Some members have mentioned some dignitaries have found it difficult to die in a dignified way. We need to consider expanding hospice service so that people don't need to be hospitalized in their final days. Secretary, for community health centers, we have also selected Kwun Tong and the Eastern Districts, and we are going to use government facilities, government buildings, and we need some time to do the fabrication. To speed up things, we are considering the leasing premises for these centers. On e-cigarette, Mr. Chair commented that this may be a way for people to mitigate harm or for people to cease smoking, but there is no concrete evidence to prove that. We will help people to quit the habit. We have the current smoking cessation service program to help these people. As for the reduction of intake of sugar and salt, well, actually next Monday, our people responsible for food policies will come to brief members. We have this towards 2025 strategy. There are 9 indicators in that, and healthy eating habits is one of them. We have earmarked $50 million to this kind of work. We'll cover the trans fat, our Center for Food Safety, and colleagues responsible for food policy would look into the measures. Last year, we published a report on psychiatric health containing 40-odd recommendations. We are going to implement the recommendations through the enhancement of our measures on care for the terminally ill patients. We are going to provide for a system of advanced directives, and the CUHK Chinese University has almost completed the consultancy on improving services so that patients can stay at home during their final days of life. There is a song being circulated on the internet sung by doctors on reducing intake of sugar and salt. If you haven't seen it, you can try to find it. Well, we haven't got sufficient time. I'll extend the meeting to 6:45 p.m. Mr. Hon CHAN Han, I would like to share with you some suggestions made by elderly people which I met on the street. They talk about the voucher scheme. At present, the value is capped at 5,000. These elderly people are concerned that one day they may be seriously ill and they may not have sufficient money to get the treatment. I know you have difficulties, but please consider allowing for a higher cap for the voucher value. And also for the abortists. Well, I received a request for assistance, and I'm grateful to the HA for the assistance rendered. The abortists was kept by the hospital, but if the parent is a Catholic, then he can seek the assistance of the church, but if not, then there's no way that the parent can do anything about the abortists. So we need to offer some help. And I have a suggestion with regard to the cancer strategy. And I'm grateful to the chairman that we held a public hearing on the strategy. And some of the deputations commented on the value of TDM1 for breast cancer patients. And if we think of the drugs offered as if it's a formulary, we need to do more. Well, at the end of the day, what we need to do is to prevent a situation whereby the cancer patient has to use cheaper drugs irrespective of the poorer efficacy because of a lack of means. So we need to offer more help to these people.
3 questions for the Secretary. Thank you. Secretary, thank you, Mr. Kwong, for your questions. I thank you for relaying the views of Guy Fong's to me. Yes, we have heard a lot of these comments, and therefore, from the cap of $4,000, we have raised it to $5,000, and we have commissioned the CUHK to conduct a study, which is near completion. When we review the whole system, we will cover all related issues, including abuses. And as for the handling of abortuses, yes, it was a subject of concern to the community. For a burial or cremation, apart from the Catholic Church, the Chinese Association of Cemeteries, and some other organizations are making arrangements for that. And FEHD and HA are discussing the details. We want to come up with a comprehensive package for proper handling of abortuses. Some mentioned the possibility of creation, and FEHD is considering how cremation services can be provided. Regarding the mechanism for cancer drugs, I can invite the HA to supplement, but I must say that our cancer strategy is comprehensive. We do not just look at treatment by means of drugs, from surveillance, prevention, treatment, and rehabilitation. We have a whole chain of services. We are going to review the whole chain of services, hoping that we can do a better job. Perhaps the HA can talk about cancer drugs. Dr. Leung, I think we've already briefed the Council on our drug mechanism. Whenever there is a new drug coming on stream, we have to evaluate its efficacy. Initially, if the efficacy is not obvious, then the Community Care Fund may fund the drug, and afterwards the Samaritan Fund, and after that it may be incorporated into our drug formulary. Many people are concerned about treatment or the use of drug. In fact, we must have sufficient diagnostic tools such as CT scan and MRI, and surgery is also important. We should not focus too much on drugs. Do we have enough operating theaters? Do we have enough radiotherapy facilities? I think a drug should be the last treatment after we have tried all other methods of treatment. So we should not just focus on drugs. We should see whether we can do better in terms of other treatment modalities. Now we introduce new drugs twice a year instead of once a year. So we have been doing it more frequently than what it was in the past. And we have increased a lot of resources for buying cancer drugs recently. Allow me to supplement. Well, for us, our discussion may be in terms of years, but for patients, time is of essence, and they are concerned about the timeliness of diagnosis. I hope you understand that the frontline faces a great burden, and I agree that there should be more resources for making diagnosis. And I think while we are in the process of discussion, many patients have lost their golden time for making diagnosis. I think we need MRI, CT scan, but the equipment cannot do its job without personnel. What about elderly health care voucher? Now, within a very short period of time, we have increased elderly health care voucher from $250 to $2,000, and now we have raised it by another $1,000 in a one-off move, and the eligibility age has been lowered from 75 to 65 years old. So within a very short period of time, we have made major improvements to the system. So elderly healthcare voucher scheme is for the elderly, and for public-private sector collaboration, we have reserved $10 billion for this. It's just that the HA has to be very cautious in reviewing the provision of treatment where the waiting time is very long. And for PPP in outpatient services, we have extended that to all 18 districts and is well received, and there is no age limit, and we will consider all sorts of expansion of services. Mr. Hsu Ka-fai and Mr. Fernando Zhang, thank you. I would also like to talk about e-cigarettes and heat-not-burn cigarettes. According to the Secretary, they're going to prohibit the sale and importation of e-cigarettes. But what about the consumption? I hope the Secretary can give me an answer as soon as possible to allay the concerns of people who are taking e-cigarettes. And I also asked shops whether they were aware of the proposed ban by the government. The majority of them knew about it, and they were very worried. And when the government announced that there would be regulation of e-cigarettes, a retailer mortgaged his home in order to expand his business in e-cigarettes. So what do you have to say to this retailer? Dr. Fernando Zhang, I still have many more questions. Now I'll invite all members to ask questions first. Well, in fact, I was very good. I abide by your rules. All right, please go on with your questions. And I have asked some expatriates taking e-cigarettes. I asked them, what if e-cigarettes are banned in Hong Kong? I was told that they would choose not to come here if e-cigarettes were banned. Do you have further questions? You please ask all questions first, because I'm afraid that Dr. Fernando Zhang may have further questions. But we are going to end at 6:45. We have plenty of time. So I'd like to know whether the CE has already made up her mind since she has announced it, and is it useless for people to appeal? Now, we have, so for smokers of heat-not-burn cigarettes, what is going to happen to them? Now, Secretary, you said that heat-not-burn cigarettes are harmful to the health, but what about traditional or conventional cigarettes and alcohol? Are they beneficial to health? Does the government plan to ban these products as well? Now, I have another meeting to attend, so Dr. Fernando Zhang, hope you don't mind if the Secretary can answer my questions first. Now, Chairman, if you don't mind, yeah, please do so. Dr. Fernando Zhang, do you mind? Thank you, Mr. Hsu Ka-fai, for your views. On the question of e-cigarettes, we intend to prohibit the import, manufacturing, sales, distribution, and promotion of such. We are now studying the legislative details. Your views have been heard, and we've been collecting views from different sectors, and we will take reference of what other countries are doing, and we will take into account our local circumstances. When we work on our legislative details, all these will be taken into account. And for enforcement, we have to discuss with other departments. When we have details available, we hope to start this discussion with the community ASAP. For those that are taking heat-not-burn cigarettes and traditional or conventional cigarettes, whether it be the WHO or other evidence, we learned that the harmful substances in these products are harmful to our health. So we appeal to the public to quit smoking. And we're going to enhance our services to help smokers to quit smoking. We will step up public education and publicity to let the community understand the harmful effects of e-cigarettes, heat-not-burn cigarettes, and conventional cigarettes. Are we going to ban smoking altogether? Now, in our Towards 2025 Strategy and Action Plan to prevent and control non-communicable diseases in Hong Kong, we plan to lower the smoking prevalence in Hong Kong to 7.8% by then. About 8 or 9 countries have announced an endgame strategy for cigarettes. So these countries plan to ban smoking altogether. It is a global trend to lower the smoking prevalence to around 5%. Our target right now is it should be 7.8% by 2025. This is just a first step. When we have general consensus in society, we'll consider introducing a timetable for endgame and the strategies to achieve that. But the first step is to ban e-cigarettes. What about tourists? I think tourists are free to choose their destinations based on various factors. As I was saying to Mr. Yu Siwing, we will consider other countries' situations before we come to a decision. What about what about alcohol? Yes, we are worried about drinking as well. The strategy for towards 2025. We want to lower the consumption of alcohol to prevent chronic and non-communicable diseases. Now we've already banned the sale of alcohol to people younger than 18 years old at the point of retail outlets. May I respond, Mr. Shiu? Although the timer wasn't activated, I noted that you started your dialogue with the secretary at 6:18, and you have spent almost 9 minutes with the secretary. Perhaps you should give way to Dr. Fernando Cheung.
We have heard from the officials and the H8 their response to questions on uncommon diseases. I'm disappointed by the answers. The government, the authority are reluctant to use this term, uncommon diseases. And as Dr. Cheung has said that, we treat a patient's disease, whatever it is. If you have a problem with your food, I'll treat your food, and so on and so forth. But 80 or 90% of uncommon diseases are related to genetic problems, and the public are not knowledgeable about them, and some not very doctors are knowledgeable about them. So if uncommon diseases are not getting a special treatment and they are treated just like other diseases, we end up ignoring them. We need the expertise apart from the introduction of drugs. Many patients with uncommon diseases are not getting appropriate treatment. In other countries, they may even introduce legislation to encourage the accumulation of knowledge and treatment protocols for these patients. And they help their patients through such measures. If we analyze the cost effectiveness of these drugs, usually they will fail your test because the research costs of such drugs tend to be high, and we are not talking about a large group of patients. And even in Japan and Taiwan, they have relevant laws enacted. They have policies and initiatives at the national level for these enacted for these patients. I'm disappointed by the response. I'm drafting a private member's bill. After I've done that, I will submit it to the President, Mr. Andrew Leung, for approval. And I would also appreciate if I have a chance to discuss my bill in this panel, Mr. Chairman. Well, I'm just the acting chairman. I would like to propose through the bill that I'm going to sponsor that we need to set a mechanism for uncommon diseases. We should first of all get a definition like Mrs. Regina Yip has suggested, and we need to get a different drug formula for these patients. And here I must declare my interest, because my daughter has a uncommon disease, which has been diagnosed in the last couple of years. But my concern about this is not personal. It's not really related to my daughter's conditions. The Secretary has said that there is a coordinating committee on the cancer strategy. I would like to know whether the committee would involve the public in its processes. And in particular, I would like to see the involvement of patients and their families. I would like them getting a chance to offer their comments and suggestions. And also for the genomic screening. This is related to uncommon diseases because 80% of the uncommon diseases are genetic in nature. I understand the genomic screening will be for the general population. You're going to conduct tests on 20,000 people. If you do the genomic sequencing for people with uncommon diseases, there may be a chance that the particular types of uncommon diseases can be discovered. I know people with the means can go to overseas countries to have such tests so that they can have the right diagnosis of the uncommon disease that their children are suffering from, but not for people without the means. Thank you for your questions. On the question of patients with uncommon diseases, and I'm not saying this lightly, HA has been doing their best to provide comprehensive treatment and services. We are focusing on the drugs because they are some of them are expensive. And the HA has got a mechanism to deal with prescription of drugs which are expensive. And we are going to see the commissioning of the children's hospital, and some of the patients are children. If we want to get a comprehensive policy, the commissioning of the children's hospital is going to be helpful in promoting the enhancement of such mechanism. The government and the HA are reviewing the mechanisms that we have already put in place. And Dr. Zhang has pointed out that 80% or many of the uncommon diseases are genetic in nature, and the HA has got a unit dedicated for genetic diseases, both for treatment and for prevention for families. NHA is also conducting screening services for pregnant women to screen for metabolic related metabolic disorder diseases. As for the generic screening project, we have a work program that we'll launch. As for genomic sequencing, some hospitals are doing this, but this is not rolled out comprehensively. We have a steering committee on genomic medicine, which will look into training needs, surveys needs, and research work. How about the committee on cancer? The coordinating committee has been in existence for some time already. Members are experts, but the strategy will cover also prevention and surveillance, and also early diagnosis, treatment, and rehabilitation. Will cover the entire chain of service. HA has got a mechanism to consult patients on treatment options, and they will be able to get some feedback. And of course, we welcome comments. You can write to us. If we want to formulate a cancer strategy for Hong Kong, so that Hong Kong can carry out prevention, diagnosis, and public education properly, there should be the need to involve the patients and families, because we cannot rely on experts alone, because experts tend to neglect certain things precisely because they are expert and they only adopt the expert's perspective. We need to involve stakeholders. I agree that having a children's hospital is helpful. That's why we want to set up a uncommon diseases center in the children's hospital to facilitate the transmission and accumulation of knowledge and expertise. And as Dr. Elizabeth Kwok has said, we need to do more tracing and offer genetic counseling for family members. If it's all over the place, the tracing is not possible, and the expertise and knowledge cannot be applied to do the prevention. I know the intention is a good one, but it takes a long time to get things going. I hope you will do more for uncommon diseases as a category of healthcare needs, because internationally they have come up with laws and initiatives already. Well, I know members are very concerned about 9 areas. First, e-cigarette and the banning of e-cigarettes and related products. And we are going to meet the officials in future HA Health Services panel again. And some of the issues may have to be revisited. We'll talk to them. All right, welcome. Thank you for your attendance. The next meeting will be held on the 19th of November, and we are going to have a new agenda for that meeting. There will be further chances for further discussion. Thank you.